Is melena a sign of diverticular bleeding? Imagine seeing black, tarry stools and wondering if it's a sign of a serious problem. When it comes to diverticular disease, understanding what your stool color means is crucial. Melena, which describes dark, sticky, foul-smelling stools, usually indicates bleeding from the upper part of the gastrointestinal tract, like the stomach or esophagus. It happens because blood from these areas gets broken down as it moves through your digestive system, turning dark and giving your stool that characteristic tarry appearance. Diverticular bleeding, on the other hand, is quite different. It typically presents as painless bleeding where bright red blood is visible in the stool. This is called hematochezia. When bleeding originates from diverticula in the left side of the colon, the blood is fresh and bright because it hasn't been digested. If the bleeding comes from the right side of the colon, the blood may be darker or maroon, but it usually does not look like the black, tarry stools of melena. Instead, it's still more associated with lower gastrointestinal bleeding, which is common in diverticular disease. There's a rare exception where right-sided diverticular bleeding can cause melena. This happens when blood from the right colon travels through the entire digestive tract, allowing enough time for digestion to turn the blood dark and tarry. However, this is uncommon and not the typical presentation. Most people with diverticular bleeding will notice bright red blood or dark maroon stools rather than black, tarry ones. If someone with known diverticulosis or diverticulitis develops melena, it's important to consider that the bleeding might be coming from an upper gastrointestinal source, such as the stomach or esophagus, rather than the diverticula themselves. This is why doctors often perform a colonoscopy to locate the exact source of bleeding. During this procedure, they can see the colon clearly and identify the bleeding diverticulum or other causes. In summary, melena is rarely a sign of diverticular bleeding. It usually points to bleeding higher up in the digestive system. Recognizing this difference helps doctors determine the right tests and treatments. If you notice black, tarry stools, especially if you have a history of gastrointestinal issues, it's essential to seek medical advice promptly. Always consult healthcare professionals for personalized diagnosis and care, as individual cases can vary widely.